Okay, so consider ectopic pregnancy for a pregnant female, especially with an adnexal mass that's sexually active and spotting. If you see a skin lesion on someone with obvious concerns for cancer, what should you get? You should get a biopsy. What's the equation for odds ratio? Well, if you have that, I guess, is it a Punnett square? No, that's genetics. If you have that 2 by 2 table, it's A times D divided by B times C. Is it necessary to hospitalize a patient who is a cutter, basically? No, it is not. There is very little, so the minimal iron in breast milk, right? So be concerned for what sort of anemia in a toddler. Be concerned for iron deficiency anemia in a toddler. After traumatic pain with passive movement, what should be on the top of the differential? Compartment syndrome. For a patient with seborrheic dermatitis, can that look like actinic keratosis or dandruff? Yep, so you want to treat with what? Selenium sulfide shampoo. You need selenium sulfide shampoo on a weekly basis to do what? To treat seborrheic dermatitis. Keep this in mind. Just because something is clinically significant does not mean that it clinically matters, okay? What's the equation for a positive predictive value? The positive predictive value is equal to the true number of positive tests over the total that is tested positive, okay? What syndrome is associated with staring up that's associated with a pineal tumor? Parnaud syndrome. Patients with ALS can have diaphragmatic paralysis, which leads to orthopnea, which is easy to confuse with what? Congestive heart failure, right? Someone with diaphragmatic paralysis can be confused to have congestive heart failure. If your patient is in extreme pain, it's a guy, you're in the ER, and he has an absent cremasteric reflex, what should be on the top of your differential? Testicular torsion. If you have a patient with left ventricular diastolic dysfunction, what is most likely impaired in this patient? Well, it would be myocardial contractility that is impaired. How do you treat a bad form of hidradenitis suppurativa or acne inversa? Treat the bad form of hidradenitis suppurativa with antibiotics or a TNF alpha blocker. If acute epididymitis is suspected, you should do a urine test. What disorder is associated with excessive anxiety and preoccupation with greater than or equal to one unexplained symptom? Somatic symptom disorder is associated with excessive anxiety and preoccupation with greater than or equal to one unexplained symptom. And for patients with somatic symptom disorder, if the exam is reassuring, you should schedule what? You should schedule a regular follow-up to keep an eye on them. How do you treat subclinical thyrotoxicosis? Treat subclinical thyrotoxicosis with antithyroid medications or radioactive iodine. Thyroid levels can be wonky if in a sick patient, so that would be euthyroid 6 syndrome. So repeat thyroid function tests in 2 months. Methotrexate can be used to treat what sort of arthritis, psoriatic arthritis. What is the first-line therapy for status blah? What is the first-line therapy for status epilepticus? Benzodiazepine. First-line therapy for status epilepticus is benzodiazepine, and you should give that for a person that has seizure for more than 5 minutes, equal to or 5 minutes. For a pregnant patient with HIV, what should be continued during their pregnancy? Continue the antiretroviral therapy, even if they are pregnant, okay? Is it okay to let a pregnant HIV patient breastfeed their child? No. No, it is not. Do not let HIV patients breastfeed, at least in developed countries. And to stop epistasis, the most medical way, how would you do it? You would use a topical vasoconstrictor and cotton pledget to stop epistasis. If you have a concern for neurosyphilis, you should do what? Do lumbar punctures and CSF analysis. And how do you treat neurosyphilis? Treat neurosyphilis with intramuscular benzathine penicillin G for 3 weeks. And what is the name of the syndrome that's due to lysis of spirochetes when you're treating a patient with syphilis? It's called the Jarisch-Herxheimer reaction. So they might get a fever. That's one of the things, and then there's some others, but the main thing is a temperature increase. What is an ideal emergency contraception for a rape victim? Ulipristal is ideal emergency contraception for a rape victim. And rape victims should also get what other sort of medications? They should get ceftriaxone, azithromycin, metronidazole, and the triple therapy, HIV therapy, and hepatitis B vaccine, and the antibody if they haven't had the vaccine as well. Hip fracture in the elderly. What sort of intervention does that require? It requires quick surgical intervention. What is the primary treatment for hernias? Surgery is the primary treatment for hernias. What symptoms are worse with hyperflexion? Carpal tunnel symptoms. And if someone with carpal tunnel syndrome, if it's really bad and it's confirmed that they have it, what sort of intervention should they get initially? They should get a wrist splint at night initially. And carpal tunnel syndrome is confirmed by what sort of studies? Nerve conduction studies. And for a patient with functional abdominal pain, you should have them keep what sort of diary? They should keep a symptom diary. And patients with cystic fibrosis with pneumonia should get what? What kind of antibiotics? Cefepime and amikacin. IV atropine is used to treat what? Inferior wall myocardial infarction. How do you treat acute dystonia? Treat acute dystonia with diphenhydramine. Acute pain and swelling of the fingernail is paresthesia. And how do you treat that? Treat paresthesia with antiseptic soaks and topical antibiotics.